That loss of human touch as a result of COVID and the need for physical distancing has been a huge challenge for everybody in the medical field. And I think we are so comfortable with sitting in a room with a patient, being able to reach out, being able to touch, being able to provide that comfort, that is something that we are grieving in this environment. But I think that telehealth can help us bridge that gap by introducing the audio and video components of a visit. It's just not the same when you're on the telephone with a patient, when you're sharing bad news or trying to get them through a difficult spot, or even trying to convey very complex information. And when we use the term telemedicine or telehealth, we really are talking about incorporating that video element as well as audio. And I think connecting visually, being able to see a patient, being able to read body language is so crucial when you can't be in the same room with the patient. So I think telehealth is very helpful in bridging that gap. The other thing that many telehealth platforms will allow is the ability to share documents. So just like you share screens and show information to your colleagues during teleconferencing, you can have a similar experience with patients. You can pull up educational materials, diagrams, algorithms, and walk patients through that information with that visual aid right there on the screen. So I think telehealth really can bridge that gap between the nurse navigator and their role and the patient without them being in the same room.